told you yesterday about Councilman Charlie Winburn's plan to save Cincinnati's health clinics by asking hospitals to take over the operation. But would that plan work? And why are some saying cutting health clinics is the opposite of what we need to do? Ben has the reality check.
In just a matter of months, the city of Cincinnati could pull funding from all of its 5 health clinics. Here are the numbers. The city is facing a $35 million budget deficit for 2012. By cutting funding from the 5 public health clinics, the city could save about $8 million a year. For 2011, those clinics operate on just over $17.2 million a year. $8 million comes from the city, the rest from federal matching dollars. But if you pull the local money, so goes the feds' money.
You shut down the 5 health clinics. All of these individuals have no health insurance whatsoever. So what's going to happen to 68,000 people?
68,000 people in Cincinnati make up the 137,000 visits to those 5 clinics each year. Charlie Winburn is introducing a plan. It's called the Adopt a Health Clinic Initiative. 5 area hospitals, each being asked to take responsibility for 1 clinic. According to the Business Courier 2011 Book of Lists, Children's Hospital has an annual net revenue of $1.04 billion. You can see the other figures on the screen. In all, Winburn calculates that comes to over $3 billion in net revenue. He's asking the hospitals to chip in $8 million collectively, or $1.6 million each per year, to keep the clinics open.
I think that the mayor and city council needs to take this threat seriously.
But the reality is that each hospital is probably not going to take control of a health clinic. That's because of the way that federal law hands out reimbursements. You see, the system would pay lower reimbursements for health services if 1 hospital took over 1 clinic. But the feds will pay higher reimbursements if it's a community board that oversees the clinic's partnership with hospitals and private practices. The board, though, has to consist of people who utilize health services at a rate of at least 51% on the board. That board is currently being assembled. So here's what you need to know. While the specifics of Charlie Winburn's plan may have to be worked out in order to make the most of federal reimbursements, Colleen O'Toole with the Greater Cincinnati Health Council tells me that area hospitals believe creating a network of health partners from hospitals to private practices and the city and county health departments, well, it's critical. If the healthcare law is not repealed, O'Toole tells me there are major concerns about what will happen to the healthcare system here in Cincinnati. In Massachusetts, for instance, when they passed their statewide healthcare law, healthcare agencies did not anticipate the enormous response that they would get from people who previously had no health insurance but were now covered. Those people overwhelmed the current system. In that case, she says Cincinnati shouldn't be looking at how to cut health clinics, but where they can find funding to open even more, and as soon as possible. And that is Reality Check.
Hey, would you like to see Ben's sources? If so, you can find them simply at the end of his story, which is posted in the Reality Check section of our website, fox19.com. It's right there. You can also make your voice heard by commenting on this story on Ben's Facebook page. Just search Ben Swann, SWANN, WXIX.
Well, did you